the fall, how it ends. It's the fall, how it ends. Oh, it's the fall, how we rise again. Ooh.
A warm welcome to all the PhysioTV viewers. I am Dr. Farheen Patel, Assistant Professor. Sorry, Amruta, ma'am, you'll have to edit this. A warm welcome to all the PhysioTV workers. This is Dr. Farheen Patel, Assistant Professor at Sanjeevi State College of Physiotherapy. And today we are going to look into something known as obesity. Obesity has recently been on the rise, and according to WHO 2016 census, there are almost 60 to 70% of population which comes under the category of obese. Let's have a small insight on what it is. Obesity refers to excessive body fat or adipose tissue. WHO defines obesity as abnormal or excessive fat accumulation that presents a health risk. The body mass index or BMI over 25 is considered as overweight and over 30 is considered as obese. Several complications of obesity, example, hyperlipidemia, insulin resistance, diabetes mellitus, hypertension, are linked to specifically the abdominal fat content increase. Our metabolism is the process of converting calories into energy to fuel your body's functions. When our body has more calories than it can use, it converts that extra calories into lipids and stores them in our adipose tissues. Now, when you run out of the tissues to store these lipids in, the fat cells are gonna enlarge themselves. And enlarged fat cells secrete hormones and other chemicals that produce an inflammatory response. This can lead to burdening on your metabolic system of your body, leading to insulin resistance, so on and so forth. Let's look into the classification. There are a few types of classifications in obesity. The first one is according to the body shape. The first is android and gynoid type. Android type, or apple, also known as apple-shaped obesity, is fat deposition above the waistline. Here you will see an altered waist-hip ratio. It is seen more commonly in males, and it has more risks of cardiovascular complications. Whereas in gynoid type of obesity, it is seen more commonly in females, and the fat deposition is below the waistline, such as in buttocks and the legs, thighs, and it is also known as pear-shaped distribution. So apple, which is android, and gynoid, which is pear-shaped. It looks something like this, where you can see in pear-shaped, the hip region and the thigh region is wider, whereas in here you can see the visceral fat or the central obesity is more. Then we have classification according to the age of onset. Now, the age of onset, it depends. It can be from childhood or can be adult. If the onset is from childhood, it is known as pediatric or adolescent obesity. The adipose cells, which we talked about, multiply also and increase in size also. Hence, you will see hypertrophied as well as hypercellular lipid cells. And this is more dangerous as compared to adult obesity. So adult onset is adipose cell size increases. There is hypertrophy of the adipose tissues, but they are normocellular. They're not hyper or hypercellular tissues. So the important point here being childhood onset of obesity is more dangerous than the adult. Then WHO has given us the classification of obesity, overweight in terms of the body mass index. This body mass index is calculated as weight upon height, weight which is in kgs and height is in meters squares. So if you put your weight and your height in meters square, and then you'll get the calculation. It comes if the BMI lies under 18.5 kg per meter square, it is going to be underweight. That means your weight is lesser than required according to your height. From 18.5 to 24.9 kg per meter square, you are within normal BMI. It means that you neither fall in underweight nor overweight. You are just where you should be. 25 to 29.9 becomes overweight, and above 30 becomes obesity. And then they have given grades also. But as an Asian, we have different geographical and environmental factors, plus our dietary habits are quite different than the European countries, which is why the Asian population categorization of BMI came into place. Here, they found out that Asian population has a higher risk of developing complications at a lower BMI, which is why the cutoff was changed for the Asian population. Here, 18.5 is your underweight, 18.5 to 22.9 is normal. You can see how 24.9 is changed into 22.9 for Asian for normal category. 23 to 24 is overweight, and about 25 is obese. Whereas, according to WHO, 30 and above of your BMI, 30 kg per meter square BMI was obese, whereas for Asian population has been changed to more than 25 kg per meter square. Now for children, because we are seeing an increase in this obese category in the adolescents. So 95th percentile, which is approximately 30 kgs per meter square, is labeled as obese. This means that the child's BMI is greater than the BMI of 95% of 10-year-old boys or girls in the reference population, which means that if I take 100 boys and girls of the same age, same population, and if someone lies out of the 95% weight range, then they will be labeled as obese. And 85th percentile is that they are at risk or they are overweight. Let's look into why exactly obesity occurs. So, etiology of obesity. The major chunk lies in energy balance equation. Now, whenever we are talking about energy balance equation, we are talking about a positive energy balance and a negative energy balance. As you can see in the photo, the picture, the positive energy balance is when your calorie intake is more than your expenditure. And negative energy balance is where your calorie intake is less than your expenditure. So what our body does is, it is gonna accumulate all the extra energy that you have and store it as in the form of lipids or adipose tissues, which is why it will create a positive energy balance where your expenditure of energy is far less than what you have actually taken in. Now, if we are talking about intake, then there will be outputs also. So our body has three major effects where it will use this energy which you have input in the form of food. So the three components of energy output is resting metabolism, that is a major chunk of 60% out of the 100%. Then the physical activity, which is the 32%, and the thermic effect, which is only 8%. Now, resting metabolic rate is the amount of energy that that your body needs when you're at complete rest. So that is the major chunk, 60%. And the thermic effect of food is the 8%, is the energy that your body requires to digest and absorb the food that you have eaten. And the major chunk comes again at 32%, which is the physical activity, how much physical activity you are doing. So as a physiotherapist, our major concern is this 32% of the physical activity. Mind you, the 32% of this physical activity also has a major effect on the 60% of resting metabolism. Other factors which contribute to one person being obese are endocrine factors, neurological factors, or can be due to your family history or genetic disorders. Whenever in negative energy balance, the energy exceeds or the energy expenditure is more, then it will help in loss of your body mass. And this is accounted for about 60 to 80% of your body fat. This sustained negative energy balance is also associated with increase in appetite, which is why a lot of people find it difficult to lose weight whenever they are purely into dieting. The effects of obesity on body are various. So you can land up with diabetes mellitus type 2, cardiovascular diseases, like we said, that if you have central obesity or visceral fat more, the risk of having cardiovascular diseases is more. Then the risk of fatty liver increases, having kidney or gallstone issues increases. You can land up with osteoarthritis or even sleep apnea, which is why we come to the point of how to screen both the adult and the child. So first is BMI, that is body mass index, which we just saw. Then is your waist-hip ratio and waist circumference. Now, waist-hip ratio is a good tool to segregate in whether you have central kind of obesity or you have peripheral kind of obesity, but it has its own lacunas. If a person comes to you who has accumulation in visceral as well as peripheral region, your waist and hip centimeters or inches will both be more, leading to the ratio coming on the normal side, which can be misleading. Hence, waist circumference came into place, which is a better outcome measure than waist-hip ratio. This waist circumference will give you particularly the circumference of the waist or the central obesity. which is why waist circumference is now more preferred than waist hip ratio, as it has more validity and reliability in the case. Then circumferences, skinful measurements. Skinful measurements is done at 7 different sites or 3 different sites. It is different for female and different for male, and it will have good outcome measure in terms of how much fat accumulation is there. And then the golden standard is the body analyzer. Body BIA is also, it is known as. It will give you, it is a machine which will give you proper body composition, as in how much weight you actually the total amount of weight that you have is actually distributed into how much of lean muscle mass, how much of fat mass, visceral fat mass, how much of water content, how much of actually the weight consists of your bone weight also. So it will give you a proper segregation, and hence it is a better outcome measure. It's a golden standard. Risk factors. All children and adolescents are at risk for obesity and should be screened. Specific risk factors include parental obesity if you have a family history, poor nutrition, you are not eating healthy fibrous food, but you are more into fast food, low levels of physical activity. These days, due to a lot of technological advances, there are less physical activity and more sedentary lifestyle that is coming into action, be it for children or for adults. Inadequate sleep, stress, this is gonna disturb your appetite, your ghrelin-leptin cycle, and it is gonna again land you into obesity. Then sedentary behavior, like we said, low levels of physical activity, and psychological factors. It has been seen that there is an increase in mental issues in children as well as in adults pertaining to stress. And a lot of them talk about eating, stress eating. So that is how it is gonna harm you. Prevention can be done at 3 levels. As the older have rightly said, prevention is better than cure. So prevention can be done at 3 levels, that is universal, selective, and target. Now, universal prevention is measures directly to the whole population, like I am going to target everyone equally, no one left out. Selective prevention is the people who are at higher risk of obesity, may be it due to they are already overweight, or they have a family history, or they have some endocrine issues. Those will be my selective prevention people whom I will target specifically and let them know that if you do not take action at this point of time, you're gonna land up with obesity. And then my target population, in whom I cannot afford to have any further weight gain and have more complications. So these are going to be my target population. So prevention can be done at 3 levels. There can be a mass awareness or camp for the universal prevention, or I can segregate people into selective prevention and then even smaller into target population. Studies have shown that a minimum of 200 to 300 minutes per week physical activity, including aerobic exercises as well as resistance exercises. Resistance exercises, also known as your weightlifting exercises, can be helpful in prevention of obesity. So if you divide 300 minutes, it is hardly 45 minutes or 30 to 45 minutes per day of physical activity. And this you can divide into 5 days of walking, probably jogging or swimming if you can. And then you can have resistance exercises also, in which you can have your large muscle groups such as your back muscles, your glute muscles, your lower limb muscles working to increase your lean muscle mass and reduce your fat muscles. there has been a global strategy given by WHO, and their main objectives are to reduce the risk factors for chronic disease that stem from unhealthy diets and physical inactivity through public health actions. That means we should have schemes in place to increase the awareness within the public, increase awareness and understanding of the influence of diet and physical health or physical activity on health, and the positive impact of preventive interventions, develop, strengthen, and implement global, regional, and national policies and action plans to improve diets and increase physical activity that are sustainable, comprehensible, and actively engage all sectors. Monitor science and promote research on diet and physical activity. Once we talked about the energy balance, we know there are two components in this. The first one is your input and the second one is the output. So the input becomes your diet and the output becomes your physical activity. If you have to maintain a proper energy balance, your input, that is your diet, and your output, that is your physical activity, needs to be balanced and well maintained. Only then will we be able to defeat obesity or prevent it, which is why only diet or only physical activity is not going to help us. We have to balance between our intake, that is our diet, and our output, that is our physical activity. With that, thank you for your attention. I would also like to take this opportunity to thank Parag sir and Manisha ma'am for their constant support. I would also like to thank our principal, Dr. Apurva Shimpi, for giving us this opportunity, and to the whole PhysioTV technical team for their constant support, and to our loyal PhysioTV viewers. Without you, we wouldn't be here. Thank you so much, everyone. And remember about the energy balance, and hope we will be able to defeat obesity. Thank you.